The thing that's the most evidence proven stuff we offer is the meds because they're not legal to sell unless you have a ton of research. It takes 5, 10 years of research to put a med on the market. Now we have a lot of other important things that get people better in healthcare, but many of them outside of meds and surgical devices don't require the same level of proof to be made available in general practice. And that leaves us to us as the licensed clinicians to decide, is there a there? Is this thing real? Is it safe? Is it efficacious? And I think often we don't think critically enough about that, about how can I rely on this being a good and necessary thing to do? Whatever it is, what kind of evidence can they produce that whatever it was worked, that it made a difference in people's lives when reasonably applied?
What's required really of a vendor in this case? What should we expect of them? And I think this is different because you're talking about a technology that's still emerging and evolving really rapidly. And so if you were selling me a hammer, we all know what a hammer is and what it looks like and what it's supposed to do and how to know if it's working or not working. That's really different than selling me something that most of us have not seen before or used before. And we're now using in a new and different way in different settings with a different context. And so I will say, from a provider perspective, I do think that the vendor selling the product does have a responsibility to know, does this work? And does it work in the way that you're telling me that it works? And I think research among vendors can be hit or miss in terms of the extent to which they engage in that. But at least having a sense of what the research says about the product and then being able to speak to, did we change our product based on what the research said? So if something big happens, what actions does your organization take with your product and your product roadmap afterwards? I think it's fair for a customer to be able to ask those questions and to expect for that you would have an answer to that, because we are social workers and psychiatrists and other kinds of providers. We're not technologists, and so there has to be a way to bridge some of that knowledge gap. And so I see it as a shared responsibility and accountability around understanding what you're purchasing and then how you're going to be using that. But I do think there's a responsibility also on the side of the vendor, to keep up with that and to try to participate in some education with the customers as well.